So this video describes why a total body assessment is needed prior to treatment rather than just looking locally. I feel that too often clinicians, if a client comes in with complaints of shoulder pain, the clinician will only look local to the shoulder prior to providing treatment rather than recognizing how relationships elsewhere in the body could potentially affect shoulder position and function. The reason why a total body assessment is necessary is that the musculoskeletal system is best represented by a tensegrity structure. Other examples of a tensegrity structure would be a spider's web or even this children's toy. One aspect of a tensegrity structure is that it's really good at dispersing compression and tension so that it's experienced by the entire structure rather than just one or 2 points. Using this children's toy as an example, you could say that the bones are the wooden dowel rods and the rubber bands are the muscles. Going back to the example of hamstrings that are maybe stretched too long that feel tight, we can say the rubber bands at the top of the structure are representative of our hamstrings. And so if I squeeze the bottom of this structure, you can see that the hamstrings would be stretched. And because the hamstrings are stretched, if I were to only look at hamstring range of motion, I could wrongly perceive that the muscles are short and that is the reason for the range of motion restriction, rather than them already being stretched too long. In this scenario, what would provide increased excursion of the hamstrings wouldn't be stretching these two dowel rods further apart, but rather alleviating compression at the bottom of the structure. That would bring the hamstrings back to their optimal length. If I were to only assess the top of the structure, I could miss that relationship and prescribe the wrong intervention. So that's the reason why a total body assessment, rather than just looking locally at the site of patient complaint, is necessary prior to providing treatment.